All right, good morning. Everybody ready for another weekend? It's coming. It's 5 days. Again, I'm going to probably count all the way from here to the end. We have 5 days left. 5 classes left, I should say. 5 days sounds very short, but 5 classes maybe a little longer. But we will talk a little bit about this today in relationship to the movie, right, that we watched and finished. I hope you have your sheets with you. And then I'll collect those and we'll move on to chapter 15, which is actually relatively brief. There's only a couple of disorders in there, but we'll talk a little bit about that. And then we'll next week finish that up and get into forensic psychology and psychology and the law. But what I want to do today is, as I said, I want to go over the worksheet and talk a little bit about the film that we took 2 classes to watch. And I hope you enjoyed it. I know it's an older film. I'm sure some of you have seen it before, but I do think that Arnie's character is a really good like discussion piece for this chapter, because I don't think his disorder is necessarily obvious, right? And so I'm curious to see what you came up with. But what I want to do is get a list going for number 2. So let's look at our list that we have for all of the things that you saw. Arnie showing like any kind of deficit in or behavioral things that were a little off. And let's see if we can get a list on the board. I'll try and like shorten them down, but anyone want to give me one thing to start? Just give me one thing you wrote down.
He spoke like really well and like really good English. It struck me as though his speech patterns were very like childlike.
Okay, so let's say like child like speech maybe. I'm just gonna kind of try and shorten it. I totally agree, right? He reminds me of like my children. He's turning 18 and he reminds me of my kids when they were like 5.
5 to 7
Yeah.
years old, that was his speech.
Mm-hmm. Perfect. I love it. That's a great starting point. What else do we have? Like, let's just get a big list going. Yeah. Okay. So we could say like motor abnormalities. Maybe you said tics. For sure, right? He has a bunch of those things going on. Yeah.
Not really a sense of danger.
Okay. Or right, climbing that water tower over and over and over again, right? That's definitely dangerous. Yeah. Uh-huh. What else? Yeah.
I was gonna say like very extreme emotional reactions, whether that's like the negative or positive.
Okay. Let's say extreme emotional reaction. What else? Anyone else? I got lots of other ones written down. What else do you have on there? Yeah.
I don't know. I have some. He can do basic tasks, but he needs help too.
Okay. So we could say like he needs care or help with a lot of his kind of basic tasks. Love it. Yeah. Okay. So for critical thinking, I think we could even add kind of what you're saying. He doesn't act his age either, right? Language-wise, thinking-wise, behavior-wise, not acting his age. What else? Anything else? We'll get some more on here. Yeah. Okay. Mm-hmm. Okay. So how can we put that? How can we shorten that? What do you think? How can we shorten that? I'll put that on you. What was that? Unemotional. Okay. Unemotional. It's also too some like kind of poor understanding of those topics, poor critical thinking and understanding. You could have that. Anything else? Yeah.
I don't have fixations.
Okay.
Which I guess is just like throughout the movie, seeing him like he has like one thing that he can't really let go of and move on from.
Yeah, he kind of gets obsessed with certainly whether it's climbing or whatnot. Yeah.
He truly believes he cannot be seen.
Yeah. Yeah. Yeah, and that's kind of, again, I think that's kind of that poor understanding of the world. We could add like understanding of his environment. Right, and that's again very childlike, right? Like, right, where's Arnie? And you're staring right at him right now. His poor sister, he's right there, right? I love that. Right? Yeah. Okay, so we say for social skills. Anything else? Right, yeah.
Says whatever comes to his mind.
Yeah, no filter, right? He does a lot of counting, right? In the movie, I love he's a 1, 5, 10. It's not quite accurate, but he does a lot of counting. Anything else that we should have up here that you have written down? Anything else we want to add? I think that I would add he can't take care of himself, right? Like the bath scene to me is kind of like a big one, that he didn't know to get out of the bathtub. He needs a lot of care, which I guess could add needs care here. Can't take care of himself is what I was thinking. Anything else? One last chance. Look over our lists. I think those are all most of the things that I have. Okay, so let's look at number 3 then. We'll go to number 3 for a moment. What are some of the, don't explain it yet, but like, let's just get a list of the different diagnoses that we think might fit him. Anyone have a thought for what might fit Arnie? Yeah. Okay, so we have IDD. Intellectual developmental disorder. What else? Anyone have a different thought for Arnie, even if it's not the whole picture? Anyone have a different thought? Yeah. So autistic spectrum disorder, ASD. Let's see how many abbreviations we can get, right? We could add a ADHD. He definitely shows some signs of ADHD. Anyone have anything else? Those are the kind of the big 3, but anyone have anything else? So let's start with IDD. So let me go to that slide here. Okay. Intellectual developmental disorder. So how many of you thought there might be some level of IDD with Arnie? Just by show of hands. A good number of you. Okay, so why? Why IDD? Anyone want to support your thoughts? Yeah. Yeah.
Because they mentioned it multiple times that he was like communication and stuff, which basically means that at that point, in the typical sense, we are sure how much the mind similar to like near like a fully developed adult, and as we mentioned before, his mental age is still like around 5, 7.
Yeah. Yeah. I think that's a big indicator, right? Like, again, he reminds me of my children, my young children who are now almost not so young. Like, they're getting so big on me. Like, stop it. Birthdays this weekend. 2 are turning 8 and the other one's turning 10 in like a month. Like, stop it. Double digits when all 3 girls are in their teen years. I'm going to be busy at work somehow. I don't know. But yeah, he reminds me of like a 5, 6, 7-year-old. I mean, at 6, my kids could take a bath and know to get out of the bathtub. So in some ways, even younger, right? The fact that he is turning 18, but he's acting very childlike, he's not acting his age, is a big support for IDD. Anyone else have other thoughts here? Yeah.
He can take care of himself. Like, he understood the concept of taking care of himself.
Yeah.
I just think he needs to be watched while doing it.
Mm-hmm.
Like, when he was handed the rag and he like ended up being super clean by the end of it,
Mm-hmm.
without Gilbert really like doing anything, but he didn't know to get out, and he
Yeah.
didn't know to grab the towel, and he didn't know to grab the robe, even though it was explained to him.
Mm-hmm.
He did get himself clean.
Yeah.
So I think he has the potential. He just needs to be supervised for doing it.
Sure. And I think that's a good point. Like, in my mind, I would put him at like the mild to moderate, right? Because he can do some of those things. And I think with a little bit more help and a better environment, which we'll get at in number 5, I think he could do better, right? Like, he understands some things, but not at a level that's appropriate for his age. I think that IDD fits him pretty well, right? In my opinion, if I had to put my money somewhere, I would put it there, just because a lot of these things, poor social skills for his age, that can't care for himself. The emotional reactions are very childlike. Children don't regulate their emotions to the degree that someone who is 18 should be able to, right? A lot of these things, not acting at his age, poor critical thinking, which again is lacking as a child, being fixated, very childlike fixations and obsessions with things. A lot of these things, right, fit IDD pretty well. But then I think we could also talk a little bit about autistic spectrum disorder, right? I think they blend them a little bit, which is so common in movies, right? That we blend disorders together. Anyone think that maybe he was on the spectrum, some autistic spectrum disorder stuff? Okay, why did you think autistic spectrum disorder? Yeah.
Yeah, repeated like speech pattern things.
Yeah.
And where he would like squeal.
Mhm.
And also like have like movements. He would do like
Yeah,
distract
he did
his
that.
nose or like throwing his hair when he was speechless.
Yeah, those are very typical behaviors of someone who's on the spectrum. The counting, the movements, the squeals, and like the sounds, very typical. Yeah. Yeah, that's also something that you would see a decent amount of. Yeah. Mhm. Yeah, yeah, I think all of those as well. Yeah,
Fixations on things.
Right.
When I'm like puts his everything into it. Like,
Yeah.
stuff matters.
yeah, that fixation piece is also something that you tend to see a lot of in people who are on the spectrum in some way. Yeah. Yeah.
Like insanely straightforward and very specific.
Right, yeah. Or even the like, dad's dead, they're repeating the things that are inappropriate, not realizing it's inappropriate, along with the repetitiveness, along with not understanding the social cues. There are one or two things that he does that are very uncharacteristic of someone with autistic spectrum disorder. So I think there are elements, if you had any of these, like you're on the right track and that's fine. Any of these three, I think there are elements of each. But any thoughts as to why autistic spectrum disorder might not fit him? Anyone know there's one or two things that he does that are very atypical? Yeah. Yeah, he is fine with like touch, right? We could also like cleanliness, his touch. He hugs people, very huggy and touchy. That tends to not be very characteristic of someone on the spectrum. Not always, but that touch oftentimes sets a lot of people who are on the spectrum off. Not the most characteristic. There's another hand. But I saw a hand over here somewhere. Okay. Yeah. Yeah. Okay, so not super responsive to, like, oftentimes sounds can be upsetting or like really intense sounds like that. He also he has a lot of language and interaction, right? And obviously autism or autistic spectrum disorder is on a spectrum, hence the name. So there are people who have ASD who are very high functioning, but his language and communication skills are not typical of someone with autism. They're much higher. Now, that's not to say it couldn't fit the motor movements, the repetitive stuff, some of his communication stuff, very autism like typical. But I do think that IDD fits him a little better. The fact that he doesn't act his age is much more characteristic of IDD than ASD. So like, again, I would put my money here, but he definitely has some elements of this that I think fit pretty well. But most people who are on the spectrum have much more severe or like much more profound impairment than you see in Arnie. He can carry on a conversation. He doesn't mind being touched. He doesn't mind not having like a set routine. Those are all things that tend to be typical of someone with autism. I want to point one thing out, just because we're not going into it in this great detail. How many of you have heard of, oh my gosh, I just forgot the name of it, Asperger's before at some point? Okay. Asperger's, a lot of you, Asperger's used to be its own distinct disorder. It isn't anymore, right? So just as a side note, just something to mention, Asperger's was absorbed into the autistic spectrum in the last DSM. So Asperger's disorder was thought to be a little bit different. It was typically someone who was very intelligent, very high functioning intelligence, but very poor social skills, right? Like no social cues whatsoever. It doesn't pick up on any social cues. But now, and it's controversial, I wouldn't be surprised to see it move again. But as of right now, autism or autistic spectrum disorder also includes Asperger's. It's kind of been absorbed into it. So if I were to ask you that on the final, is Asperger's its own unique disorder? Not anymore. Okay, and so that's something that changed a couple of years ago. Yeah.
Is that same with like Simone Syndrome?
Yeah, so Savant syndrome is sometimes referred to with IDD. So typically someone who, and they used to call it like an idiot savant. Thankfully they changed that. Now it's Savant syndrome. Somebody who has very low global intelligence, but then they're incredibly gifted in one area. Like I always think of Rain Man. There's lots of examples of this in movies. But somebody who maybe has incredible memory, right? Or incredible musical skill or mathematical skill. But in every other area of life, they're really impaired. That would be typically, it's like an offshoot of this, or it's kind of its own, that is its own like separate disorder. Okay. Other thoughts about IDD or ASD? Any other thoughts like diagnosis wise about Arnie? Again, I think either one of these fits. It's kind of a blend, but I again would put my money here if I had to choose one. He also shows a lot of signs of ADHD for sure, but I don't think that it's the main thing with him, right? But you can see that like inattention, that hyperactivity, this is a very common disorder of childhood. And we've talked about it many times. It's come up many times in here. But ADHD, attention deficit hyperactivity disorder, also had a lot of changes occur with it in the last like 10 years. There used to be ADD and ADHD. Now there's just ADHD. And we specified if someone had like a hyperactive type or more of like an impulsive inattention type. And so this one has also undergone a lot of like revisions in the DSM. And we see some symptoms of this, right? But so if you put that, that's fine. But I would really say one of these two kind of fits him the best. I think it makes for a good differential because it doesn't quite fit either perfectly. How about for number 4, what are some things that you think might have contributed? Maybe it's not the whole picture, but what might have contributed to some of his pathology? Yeah.
Go to school. He seems to
Yeah.
be at home or at work with Gilbert, but even at work, he's just sitting around eating candy, really learning anything.
That sounds so awful, doesn't it? Sitting around eating candy all day. Yeah, you don't see any school. It might be summer, but it feels like we get enough of a picture of it that like, yeah, there's no school at any point in the film. What else? What other contributors? Yeah. I don't think that helps, right? There's no structure. There's very minimal supervision. There's not a lot of routine. All of those things would definitely help. And we could add them for number 5 of things that would help, right? What else? Yeah. Yeah.
Herself, while she does try her best, it's becoming a person.
Yeah. Mhm.
So that's Gilbert, but mind you, he's still very much. I don't know his exact age.
He's a
but-
teenager, right? I would assume
Yeah,
he's like
he's still a child in 100%. So having a child being after a child, especially one that's like very high need.
Yeah. I hope all of you put the family down, right? I think that the family dynamic structure, lack of routine, all of those things, I don't think they're helping. They may not be the cause, but they're definitely not helping. There was a hand over, yeah. Right. Yeah. I love that you speculated, right? Because you could totally do that. There's a lot that we don't know, but we could wonder if something happened during the prenatal development or during childbirth, or something that his mom maybe ingested, drinking, smoking, all those things could definitely affect the development of an unborn baby. Yeah.
They don't really trust him to do any tasks himself. They do everything for him, other than like competing. But even then, his sister would like grab food and put it on his plate. When in the bath, Gilbert's the one with the rag. The only time they ever trusted him to do something by himself,
Yeah.
they left him completely alone.
Mhm.
So they don't really like let him do anything.
Yeah.
So
And I think if they pushed him a little bit, like he could make progress, right? I always speculate a little bit about like maybe some kind of a like childhood injury, like something. I mean, again, we don't know, right? But we know that his father committed suicide, and hope you picked up on that, right? He hung himself in the basement. They're kind of vague about that, but his father clearly had mental health issues. We don't know a lot about that, but like that might have been a trigger. Maybe there was some kind of, he likes to climb the tree. Maybe he fell when he was younger and there was some kind of like brain trauma or head trauma. They talk a lot about him. He was supposed to only live so long, right? Very common that people who have like severe, autism or severe IDD have shortened lifespans because the judgment is impaired. And so sometimes there are more accidents, or not always, but maybe there's something there. Maybe something happened to him along those lines that we don't know about. Could speculate a little bit, right? Any other thoughts there? Any other thoughts with number 4 before we keep going? Yeah.
There's no real discipline.
Yeah.
At all. The only time he's ever really been disciplined is out of anger and frustration from them.
Mhm.
Versus it's not really discipline, it's more so abuse because they just hit him.
Yeah.
But there isn't any like he would climb the tower and then they would just be like, you can't do that again. And
Right.
then that was the end of it.
Yeah.
There's no anything.
You go to jail and let me just rescue you. No big deal. No punishment. Yeah. There's definitely a lot of that, right? And that's such a hard scene to watch when Johnny Depp's character, when Gilbert loses his temper and smacks him around like quite a bit. I mean, if any of you have ever had to care for or known someone with, one of these disorders, it can be just constantly challenging. And I'm not saying that's okay in any way, but I like that they showed that difficulty, right? Because it is something that can be very difficult to tolerate on a day-to-day basis. And it's not something that he should have had that responsibility for, right? There's a lot of like diffusion of responsibility in that family, no punishment whatsoever. Was there another hand? Yeah. 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 I think that doesn't help either, right? If there is a school, we don't see it. There's not a lot of options and stimulation there. Yeah.
And granted, this is filter, so I don't know how things work out there.
Sure.
But even so, it's because we live in a rural area and to based on their circumstances, they go very to hospital and stuff, you could tell that they're going to work.
Mhm.
So even if they did decide to get help, they necessarily be able to afford it.
Okay. Yeah. Yeah. Lots of little contributing factors. I love it. I love that you're thinking of all these like little or things that could obviously add up to play a role. Yeah. Yeah. Mm-hmm. No, that emotional environment is tense. I love when she throws the baked potato. I'm like, that was a hard baked potato to break the window, right? Like they didn't cook that thing enough. That's all I can think every time. But yeah, there's a lot of fighting and tension and not the healthiest family environment. And while that might not have caused it, I don't think it's healthy, right? I don't think it might be exacerbating what's going on. How about some ideas for interventions or treatments? What are some things that we could maybe do to help either him or the family in some way? Yeah.
Seeing a trained professional,
Yeah.
just like social coaching, learning coping skills for like the emotional responses that he deals with.
Yeah.
And I think like importantly is like getting him involved socially somehow, and like whether it be like a special ed school or something where he can build more relationships with people and like expand in that way. So
Yeah.
seems to be lacking in that department.
Oh, for sure. I think those are all great things, right? So getting him in to see someone, right? And maybe getting him tested, evaluated, find out what is going on. Let's find out. And then I think the schooling was a huge piece, right? We don't see it again. We could assume it's summer, but like getting him into a good program that is going to help him. I think those things would be huge for him. What else could we do? Even if it's small? Yeah. Yeah. Right. Conditioning, right? Rewarding. Let's teach you how to do certain things. Skill training, right? Like washing himself and then getting out of the bathtub. Do that repeatedly. He'll know how to do it, right? I think that he has a lot of potential to be able to do a lot of different behaviors if he was taught and got like rewarded for it, conditioned and taught how to do it. You had your hand up. Yeah. Yeah, right. Parents need training too. I mean, obviously we end the film with the mom dying, which is so sad again as well. But whoever's caring for him, getting some training and education. Anything else we want to add or could add to help him out? I was thinking family therapy, right? In my mind, I'm like, send the family to therapy together. That would be interesting to see. But changing the family dynamic, I think, could be helpful. Did I steal your thought, or did you have anything else? Yeah.
Minimum structure.
Yeah, I love that, right? I think a routine and a structure, which has been mentioned a few times, would really go a long way for him, trying to get him a little bit more support and help. And structure and routine, all those things are gonna help. Right. Any other comments about the movie or film at all in general? Any other like thoughts or comments or anything about your experiences and living with or working with or being around people with special needs? Anything else before we move on from 14? Yeah.
I would say, like, Arnie himself, he reminded me so much of like my friend back in high school. She had a brother who had like very similar symptoms to Arnie. So when I was just seeing that, it just brought back flashbacks.
Sure.
Like, just like seeing how basically they had to like learn certain things because of like this conditions. Like,
Yeah, I think he did a really good job as an actor of portraying somebody struggling with the things that he was. It's very typical of a lot of like children or even adolescents who are struggling with those issues. Yeah.
I think people realize that when the parents are out of commission, emotionally and responsibility wise, kids always have to step up in that situation.
Yeah.
And all three of them stepped up despite being as young as they were.
Yeah.
And not really wanting to stay in the house because you can see Gilbert leaving and
Yeah.
trying to find a way to get out of his life. But then because like when he was talking about one woman who's in her parents, she was like, I picked you because you have nowhere else.
Yeah.
So it was like he was almost in that very toxic environment and he had to do everything for his brother.
Yeah, and you see that a lot, right? I think they portrayed those things, pretty well. Obviously, it's a very rural environment, which I think has its own unique challenges. But I think the dynamic that they have isn't atypical, right? And again, these disorders are relatively common, right? For most kids, they have a happy, typical childhood, but a lot of children struggle with ADHD. That one's probably the most common of everything up here. My oldest twin, I would bet my life has ADHD. Like I know it. My partner's in like complete denial about it. I'm like, nah, she has ADHD. Like I know this, but we help her all the time. Like she's always squirmy, never paying attention. Like, and some of that is super normal for her age, but it's also like there's that level where it's just beyond what you would expect and is typical, right? And you see a lot of ADHD. We see a lot of autistic spectrum disorder. There's more and more autism that's present in intellectual, delays that are present. So I think just knowing how to recognize them and knowing the signs of them is a good first step. And then making sure you're doing things to help when people are struggling with them. Yeah. Sure.
So how are you able to differentiate this kind of being like a little bit?
Yeah. Oh, isn't that just the biggest question in mental illness, right? Yeah. It's severity, and I think that's the case with any mental illness that we talk about. You have to look at, we were just talking about this in our intro class before, right? That everybody has some element of all these, right? Like we all have moments where we're, unattentive and hyperactive and don't want to sit still. Like it's hard to sit still on a desk and pay attention for any length of time, right? It's difficult. But you look at when it starts to interfere with their life to a degree, that's when we say it's no longer like typical or normal, right? So like with my daughter, for example, in kindergarten, she couldn't sit still during circle time. I wasn't worried about that. I don't know a lot of kindergartners who sit still during circle time, right? Like they want to be outside, they want to be playing, they want to be moving. That didn't worry. But this year in second grade, where she can't follow instructions, she can't sit in her chair, she can't, like it escalated. It's escalated. I'm like, stop it. Speaking of can't pay attention, right? It escalated in severity, and to the point where it affected her grades and her friendships, and she had to be on a behavioral chart, right? So all of a sudden, it's gone from like everybody's kind of struggling to you see it a little bit differently in this individual. And so I think a good rule of thumb with any mental illness is when it starts to affect somebody's ability to function and live their life, and it affects their friendships, their school, their work, their life in some profound way, that's when we start to view it as a disorder. But even then, I mean, it's such a gray area, and that is like really the $1 million question with any mental illness. When does it cross the line? And there's no clear answer for that. So I think just looking at it interfering with life or taking up time or energy or causing problems, that's when it kind of crosses over. Yeah. Anything else? Other questions, thoughts, anything? Yeah.
So, when the, like they say, symptoms itself is like having to have a prescribed structure, or else it kind of is a person opposite.
That's very common, right? With autistic spectrum disorder of needing that structure. And oftentimes people with severe autism won't do well with the structure or the routine being disrupted in any way. It's like, this is what's going to happen. And if it's disrupted, a lot of upset, like can't handle the adjustment. It's typical.
So can you difference between autism and then obsessive compulsive personality disorder? So would it be like basically having to like figure out like if they fall to other symptoms or if they kind of like similarity between those two?
Sure. So obsessive compulsive personality disorder, OCPD, is a lot of like everything has to be just so and perfect, right? And you can't handle the changes of like flexibility, like everything has to be a certain way. It's very rigid. And you might see elements of that in autistic spectrum disorder, but then there's also all the cognitive like pieces, the motor abnormalities, the language difficulties. So it's looking at that big picture, right? So somebody could in theory have both, but typically behavioral stuff for autism, very different. OCPD, we wouldn't typically diagnose until someone's 18. Typically with personality disorders, we try and wait till they're technically 18, just because we're changing so much through our adolescence and childhood years. So they really do present very differently, but they have a few things in common. So if you see those things in common, you're going to have to look at the big picture to see what else is going on. What age are they? What else are they doing? What's their intellectual capacity? So, all right. So if you want to make sure your name is on those and go ahead and pass them up, I will take them from you. We'll move on. All right, do I have everyone? All right. So what we'll do, we'll move on now to chapter 15. So we just talked about childhood. Now we'll talk about the other end of the spectrum. Make sure, as a side note, that you go back and kind of review anything that we didn't talk about in chapter 14. You know, we talked about some things, but not everything. Let me erase this really quickly as well. Speaking of OCD, I sometimes want to just keep erasing and see at what point somebody would say something, right? just keep going for like 5 minutes. Stop there. All right. But chapter 15, as I said, we're looking at the other end. Okay, so geropsychology, getting older, disorders common among people who are over 65. I put this picture of like the fall leaves. My grandma used to always say she was well seasoned, right? And I like that. She's like, the older I get, the more seasoned I am. I'm like, that's slightly frightening to think about, but okay, like, all right. So I had that in her honor. She lived to 102, so she was very well seasoned, overly seasoned at the end of her life. But these disorders of aging were in the realm of geropsychology. Geropsychology is looking at the mental health of people who are elderly. And in our culture, we define elderly as past the age of 65. So 65 is kind of the point that we define as being elderly. And that can be defined differently in different places, different cultures, but that's our definition. And just like any other age, right, being older, being elderly has special pressures and upsets and changes. There's different things that are happening. It's typical of childhood, adolescence, adulthood, and of course, when you get older as well, right? There are certain changes that occur that are very common. And then there are things that can occur that aren't so common. And that's what we'll talk a little bit about. In general, we can talk about two groups of disorders that can happen to people who are older. There are disorders that are common among anybody, and they can also happen when we're older. And those are the ones we've been talking about all semester, right? Like all of the things that we've covered so far can happen when you're young, when you're older, when you're in the middle. And then there are disorders of cognition, which we'll focus more on, that tend to be very common in people who are over 65. So the first group we'll just touch on very briefly, because we talked about this all semester long. People who are older can struggle with the same issues as people can struggle with when they're younger. Depression, anxiety, substance abuse, schizophrenia, substance disorders, any of the things that are up here. Depression tends to become more common when people get older, as you maybe lose some of your friends or abilities or like life purpose if you retire and you don't have that sense of like something driving you. Not always. So a lot of people who retire are like ridiculously happy. They're traveling, they can pursue their stuff that they've always wanted to do, and they're in a great place. But obviously things like depression and anxiety can be common as we get older. One up here that is like warrants just like an extra thought, substance abuse in the elderly populations tends to take a slightly different appearance than it does when we're younger. There is a group of drugs that people who are older tend to abuse more often than not. Any guesses what that might be? Yeah. Okay, it's a good guess. Pain medication is very common, even broader than that, just yeah. Okay, that's for pain, right? That would work. Prescription medication, right? There could be that as well, right? For antidepressants, anything prescribed, right? So it could be technically you were all correct, right? Substance abuse in the elderly often takes the form of prescription medications. It can be intentional or unintentional, but it's very common that people who are older abuse prescription drugs. My mother-in-law is so bad at this. It's like the doctor prescribed her 500 milligrams. Like, okay, take one of these once a day. She's like, well, if one is good, I'll take 3, right? Like she knows better than the doctor because she's older and she knows better, right? And that's very common in older like adults of that like, well, I can kind of make up my mind, I know best, right? And maybe, but they prescribed it to you for a reason at that dose, right? That's very common. Sometimes you see people forgetting, did I take my medication already or not, and taking it again, which can have dangerous side effects, or going from doctor to doctor to get medication purposefully is another way that you can see this too, right? Of going to the doctor to get pain medicine and then going to another doctor to get pain medicine and kind of accumulating those prescriptions. So very common to see substance abuse in the form of prescription medication in older groups, just as a little side note. But these can happen at any age, including being older. The ones that we're a little bit more interested in for our class and our purposes are the disorders of cognition. These are very common, sadly, in elderly groups of people, right? What we see is as we age, right, and we experience this from a very young age, even in like our 20s, this starts. As we age, small mishaps in memory become common. Where did I put my keys? I forgot to do this. What did I come in this room for? Right? Like all of those things are super common. Right? I guarantee all of you have had those moments where you walk in a room and you're like, why am I here? Right? And then you walk out and then it comes back to you. Right? Or you can't remember where you put your keys. You forgot your appointment that you had, whatever. Those things happen all the time. They happen more when we're distracted, when we're tired, we haven't slept enough. But we see that they happen more and more the older we get. Right? I guarantee all of you have had a grandparent or parent tell you the same stinking story over and over and over again, right? Like I have heard the same stories from my in-laws. Like they will like just repeat it on a loop. Like you guys are not old enough to be doing this yet. Like stop, right? Like they're in their early 70s and they're just always telling you the same thing. right? That becomes more and more common as we get older. That's normal. But there are some people that have much more extensive changes to their cognitive ability as they age. And that's more what we'll focus on. So one interesting distinction that we sometimes make is there's something called delirium. And there's something called dementia, which is now actually called a neurocognitive disorder. So dementias and deliriums, they're slightly different things. Delirium is something that tends to have like a very fast onset. Right, it's something that tends to happen very quickly. Maybe it's the result of a fever or an infection or the result of like a surgery, right? It's something that happens very, very quickly where someone is confused. They don't know where they are. Maybe they're hallucinating. They might have a clouding of consciousness, that, again, a lot of confusion, but it tends to come on very, very fast, right? Someone is fine and then they're not. Right. I actually had delirium when I was hospitalized like a week and a half ago because my blood pressure was so high. I did not know where I was, right? Like I had no clue where I was. I just started crying. Like I was at the hospital alone at 3 a.m. and I didn't know where I was. It was so scary because my blood pressure was through the roof. It was a medically like induced confusion. This is typically medically induced by like an infection, a stroke, and some kind of like medical issue. On the flip side of that, it tends to be something that we can correct or fix. Or another word we can say is treat. My blood pressure came down, my delirium went away. Like I was fine again, right? Well, that's debatable, right? My partner said that's debatable, but I think I'm fine again. You fix the infection and it goes away, right? So if you can identify the problem, you treat it, it's gone. Fast onset, easy or possible to correct, fix it, and treat. Yeah.
So like if you get a concussion, is that the
It's more like that's more like a specific like type of injury, but the way that it presents might be similar. The confusion, loss of consciousness, but that one is a little more like that's more of like a specific condition, but it might manifest in a similar way. Dementia, very slow onset. Years, builds up slowly over the course of many, many years, right? Oftentimes 2, 3, 4, 8 years. It can take a long time. It's a very slow build. And oftentimes with these, they are difficult, if not impossible, to treat or fix. There are things that we can do to slow them down, but you can't treat them, you can't cure them. But the dementias, like Alzheimer's and things we'll talk about more in a moment, are fatal, right? It might take a long time, very slow, but we don't have things that reverse them. We can slow them, but we can't cure or stop them. So these tend to be very different things, right? Dementias or neurocognitive disorders are long, slow conditions that oftentimes have a very unfortunate end that can be very fatal or just very damaging. Delirium, very fast onset, but we can often correct, fix, or turn it around as long as we identify what happened. And there are lots of neurocognitive disorders. The most common one by far is Alzheimer's, named after Alois Alzheimer, who was one of the first patients or people to discover this back in the early 1900s. But Alzheimer's is a very common form of dementia or neurocognitive disorder. How many of you have known someone in your life who struggled with Alzheimer's? A lot of you, right? It's a very difficult disorder for the person who has it, but also the people in their life, right? It can be very difficult to be around and to process. Any stories or comments or thoughts or anything? A lot of you raised your hand. Grandparents maybe who had it, or any thoughts? Yeah. Yeah.
So someone speech was actually still there.
Okay. Sure.
So on the from there upstairs to that continuing forward on his stuff and to get his stuff.
Yeah.
And he kind of like accuses us of taking it. So that kind of aggression just like is on over time, like just for like material belongings.
Okay. Yeah. And that kind of like confusion like that. And being in the wrong time can be very, very common, especially in the later stages. Anyone else? Any other?
It's so, I mean, it was difficult to deal with, but it was interesting to see kind of the phases she goes through. So it starts off, you know, just little things like
Yeah.
forgetting that you eat or forgetting that you didn't eat or whatever. And then eventually they go through this stage kind of where they're like more paranoid, like suspicious of others. We couldn't have her with her roommate at like the home that we had her in.
Sure.
Like accused her of stealing her stuff. And then it eventually goes to the point where she like, it's like, oh, I'm just gonna walk down the street to see my parents. And it's like, the parents died 20 years ago.
Right.
Like, they're not back in
Right.
college.
Yeah.
Those are the days where they like forget how to do basic human functions, like
Right.
eat, talk, everything. So like I would
Walk,
visit her
yeah,
house,
everything.
and she just didn't chuckle to herself, but there was not much like communication other than that.
Yeah.
And so it's just difficult to kind of go through that because it gets to a point where it's like, that's not my grandma anymore.
Yeah.
And that's not the same one I grew up with and who took me to McDonald's and all that kind of
Mhm.
stuff. So it's just, it's interesting.
It's sad and difficult, isn't it? Because there's a point where there's a profound personality change that occurs. And I think what's so cruel about this disorder is sometimes people who have Alzheimer's will have pockets of lucidity. Like, so you go see them and they know who you are and they interact with you and everything's fine. And then 2 seconds later, no clue who you are. Right. Or, it can be hard that way because you don't know what to expect. And then eventually that disappears and there is no more of that. My dad had Alzheimer's. I lost my dad to it like 3.5 years ago at this point. He actually had Lewy body dementia, which is very similar to this. But, at the end, he would call me. He thought that it was almost funny. You have to find ways to laugh at it as much as you can. But he would look at my mom, and they were married for 38 years. He'd look at her and be like, did I ever get married? And she'd be like, yeah, to me. And the look on his face would be like, oh, like, hi, who are you? Like, it was kind of endearing. It's sad, obviously, but it was also really cute in another way. He'd be like, did I get married? And this would happen over and over again. And every time, to his like amazingness, like he never looked disappointed, which is great, right? Like he never looked at her like, oh, like it was always every time like, hi, like nice to meet you. Like it was kind of cute and endearing. But at the end, like he didn't know who we were. Like he didn't remember her. He like had gone back in time like 20, 30, 40 years, and it eventually hits a point where they're no longer aware that they have it. And it's almost easier at that point. Right, when they are aware that they have it and they're battling like what I could do versus what I can't do now, that's when it's actually the hardest. At the end, in a way, it's almost a little easier because they're no longer aware that they have the disorder. But it's just a very cruel, difficult disorder for that person and also their family. Yeah.
So my grandpa, well, the doctors diagnosed him also. But when he was like, I don't know what age he was, but he got hit by a car and he suffered like a brain injury. He was like, what?
Sure.
For like 2 weeks or something. So they don't know like that might have caused it. Maybe the doctor like diagnosed him or something because he remembered like because he lived with me, so he remembered like all of our names.
Yeah.
The only thing he would claim forget was like he'd be like, oh, I'm hungry, but he just ate like 5 minutes ago. We always asked where my grandma was, and she was just in like the other room. So we don't know if like he was like this because he never actually like how some people like forget to swallow or like forget like some like something that you never would.
Sure.
And then his sister had like schizophrenia, so when they were talking about it was all releases.
Yeah. Between those two conversations, that could be interesting for sure. But I brought up this next slide. There's something called vascular neurocognitive disorder, very commonly caused by like an accident or a trauma, a head trauma or stroke. And so sometimes what we see is that people who have those kind of physical traumas develop like a form of dementia, but it's more due to a trauma, but it might manifest somewhat similarly as something like Alzheimer's. This is really due to a couple of things in our body. And neurofibrillary tangles and senile plaques are the two biggest culprits when it comes to Alzheimer's. Now, every single one of us has these, but they build up as we age. And what happens is they start to slowly block normal, like neural transmission. And so our neurons stop communicating with each other properly. They interfere with memory. They disrupt the hippocampus. And they build up enough that they make it very difficult for the brain to function properly. And so it's these two things, along with some neurotransmitters, that are thought to be the big culprit. And you can't diagnose this with all, like 100% certainty until after someone has died. You can see the effect of these plaques and the buildup in them in the brain if you were to do like an autopsy, or if you do something like an fMRI or a PET scan, you can see that the brain no longer lights up and functions the same way in response to stimuli. But this is, again, it's a progressive disease, on average 8 to 10 years between onset and unfortunately death. It is something that is fatal, that we've made a lot of great advances in some of the treatments. So we're working toward treatments, but there really isn't one as of right now. I have a little video that describes the, I mean, the physical progression really, really nice. I do have this little video that kind of highlights it. I'll play it for you. I think it tends to be something that progresses in stages. So